April is National Minority Health Month. The goal is to raise awareness in minority communities to be more proactive about their health. And joining me now is Brian White, co-founder of DoorSpace. Good morning, Brian. What is DoorSpace?
Good morning, Haley. DoorSpace is an employee data management company. We offer a free app for individual doctors and nurses to manage their career data from graduation to retirement and provide instant access to accurate, organized, and usable employee data for healthcare organizations. Our goal is to make life easier for healthcare workers so they can spend more time on patient care and less time on administrative tasks.
I'm still a little bit confused. Give me a specific example of how they might use this in clinic.
Yeah, so anytime that you have a career where you have to update, maintain credentials and other licensure, we make it easy to maintain that. Right now, doctors and nurses are spending an average of 50 hours a year doing this. And so we're trying to take time away from administrative tasks like that and give them time back in their day for patient care.
How does that help with the disparities in healthcare when it comes to minorities, which is obviously what we're focusing on during today's interview?
Yeah, absolutely. So a tool like DoorSpace can help provide healthcare workers with a personalized employee development plan so that we can help promote career paths that would not only give more underrepresented people positions in leadership, but then also support those decisions with data and evidence to show that everybody benefits from that.
Okay. What's some of the data that you've found about illnesses, diseases, conditions that impact Black and Hispanic Americans in particular? Because when we're talking about health disparities in minorities, specifically Blacks and Hispanics come up pretty frequently.
Yeah, absolutely. It seems like there are disparities in almost every aspect of healthcare anywhere you look. African Americans have the highest mortality rate of any racial or ethnic group for all cancers combined. Infant mortality rates continue to be more than twice as high for Black women. HIV diagnoses are disproportionately high in the low 40% for African Americans, although they only make up about 13% of the population. When you look at mental health, suicide attempts were over 60% for African American high school girls and about 30% higher for Hispanic girls than white girls in 2019. And again, this is why representation in healthcare is so important.
And how is your company working to reduce those disparities?
Again, we're looking to use data to find ways to identify gaps in healthcare, not only to improve patient care, but issues like racial disparities through hiring practices and promotion of career development plans. What
kind of glaring disparities are you seeing? Like, what are you trying to target right now?
Well, I think that you can take a look at executive teams in healthcare and you can see that there's underrepresentation for minorities. And you can look at the rates of graduating classes and you can see that minorities such as Hispanics and Black Americans are underrepresented there as well. So finding ways to promote career paths that would, help improve those ratios obviously would have a benefit on patient outcomes and disparities in healthcare.
Yeah, so I do the health reports, and just like an hour ago, I was interviewing a doctor, and we were talking about how few minorities go into mental health care. Finding a male Hispanic therapist in Texas is next to impossible. So what are you doing to reach those communities and say, like, hey, these are career paths that you should be on because there's a need for those people?
Well, it's really interesting, especially in rural communities where, the gaps in disparity are even higher. Being able to partner with local organizations like schools, law enforcement, any type of government agencies in those communities has great results when you look at the impact it makes for bringing awareness and improving the rates of people participating in those programs. Not only getting people interested in joining the workforce, but staying in those communities to provide the care where it's most needed.
Yeah, that's true. That's also a challenge. Anything else that you'd like to say about how you guys are working to reduce racial disparities in healthcare?
No, I think that, raising awareness and, making sure that it's a focus is important. Continuing to promote the use of DEI programs within healthcare organizations is huge. And I think, again, representation makes such a big difference. When you look at the impact it's had on some of the ratios we were talking about earlier, it's not just that some of the communities are disproportionately high in diagnosis, but it's also the care that they receive because they're being treated by people that understand, their unique socioeconomic and backgrounds and different, things that come to the table when it comes to patient care.
Yes, very good statement. Thank you so much, Brian White with DoorSpace. We appreciate you taking time to call in this morning.